In the fetus, the skeletal system develops first as hyaline cartilage. Bone growth, or ossification, begins at centers of ossification. These lead to fully formed bone.
There are two types of bone growth. Epiphyseal growth. This type of growth occurs when bones grow in length. It begins at the growth plate, or the epiphyseal plate. Appositional growth. Appositional growth is characterized by a growth in bone thickness and occurs by ossification of cartilage.
Hormones and materials needed. Vitamin C, which is required for collagen synthesis. Vitamin D, which is required for absorption of calcium, which makes up the bony matrix. Thyroid hormone, such as calcitonin, which discourages growth, or parathyroid hormone, which encourages osteoblast activity, and sex hormones, such as testosterone and estrogen, which stimulate ossification at the growth plate and are also responsible for the masculization and feminization of bones.
Bone makeup. The main constituent of bone is the bony matrix, or formed element. 35% of this matrix is organic, composed of collagen and proteoglycans, and 65% is inorganic, composed of hydroxyapatite. Bones are also made of bone cells, categorized as osteoblasts, which create, osteocytes, which maintain, and osteoclasts, which destroy.
Bone cells are constantly destroyed and rebuilt in a process called remodeling. This encourages healthy bone composition and strong bones. Cancellous, or spongy bone, is made of rods of bone called trabeculae, whose crisscross pattern give the bone strength by dispersing pressure in many directions. Compact bone is more dense and located on the outside of the bone, just under the periosteum, the protective bone covering. Remodeling depends on the osteon system.
Bones are made of repeating units called osteons. Osteons are composed of circles of bone called concentric lamella. Osteons are fed nutrients through their blood supply, which flows through the central or Haversian canal of each osteon. The nutrients go to lacunae, which contain the bone cells.
Functions. Support. Bones bear weight to support the various tissues of the body. Protection. Bone is hard enough to protect the organs it surrounds. Movement. Bone acts as an anchor for muscles which attach their perforating fibers in the periosteum and move the muscles during contraction. Storage. Minerals in the blood are stored within bone. Blood cell production. Bones contain cavities filled with bone marrow, which produces blood cells and platelets. Types. Long. Long bones are longer than they are thick. Short. Short bones are thicker than they are long. Irregular. All bones not easily characterized as long or short are deemed irregular.
Bone disorders at birth. Cleft palate. Cleft palate occurs when the two parts of the maxilla do not come together, disallowing suction in the mouth. Fontanelles. Fontanelles are underdeveloped portions of the skull, which leave the brain open to damage. Spina bifida. Spina bifida is an incomplete closing of the bones and membranes surrounding the spinal cord. Rickets. Rickets results from a lack of vitamin D and causes reduced mineralization of the bony matrix, resulting in bowed legs and inflamed joints.
Types of fractures. Closed. Fracture is complete but does not break through the skin. Open. Fracture breaks through the skin. This is the most dangerous type of fracture because the body is open to infection. Comminuted. Bone shatters like broken glass. Impacted. Bone pushes into itself, resulting in a shortened, compacted bone. Green stick. Bone breaks diagonally and not completely, like a still green stick.
The healing process. This process involves generalized cells, blood, collagen, cartilage, and finally bone. The first step is hematoma formation. When bones break, blood vessels also break, resulting in the pooling of blood under the skin called a hematoma, or a bruise. The second step is invasion of the site by generalized cells. First, osteoclasts break down dead bone tissues, and fibroblasts produce a fibrous collagen network. Next, chondroblasts create cartilage over that collagen network. All of these cells push out the bone periosteum, resulting in the formation of a bone callus. The third step is callus ossification. Eventually, the fibers and cartilage of the internal callus are replaced by cancellous bone produced by osteoblasts. The final step is remodeling. The callus decreases and normal remodeling begins. This process takes around 6 to 8 weeks for adults and around 4 to 6 weeks for kids.
Disorders at middle age. Gigantism. This disorder is characterized by abnormally tall height and is caused by excessive cartilage and bone formation at the epiphyseal plates of long bones. Dwarfism. This disorder is characterized by abnormally short height and is caused by low levels of PTH. Acromegaly. This disorder is characterized by increased diameter of all bones caused by a growth in connective tissue due to excess PTH.
Age effects on growth. Higher levels of calcitonin and lower levels of PTH result in decreased bone remodeling, causing bones to be weak and brittle. Loss of bone increases the risk of fractures and causes deformity, loss of height, pain, stiffness, and loss of teeth.
Joints. Plane. Plane joints occur when two opposed flat surfaces meet. These joints are monoaxial and display slight gliding motion. Saddle. Two saddle-shaped surfaces orient at right angles. These joints are biaxial and allow sub-movement. Hinge. These joints occur when a convex surface meets a concave surface. They are monoaxial and allow some movement. Pivot. Pivot joints are characterized by a bony process that rotates within a ring. These monoaxial joints allow little movement. Ball and socket. These joints occur when a bulbous shape meets a concave socket. They are multiaxial and allow for a wide range of movement. Ellipsoid. Ellipsoid joints are similar to ball and socket, but the shape of one surface is ellipsoid rather than bulbous. This limits movement by making the joint biaxial.
Age-induced disorders. Osteoporosis. Osteoporosis, or porous bone, occurs when bone reabsorption happens faster than bone formation due to increased levels of calcitonin and decreased PTH. Osteoporotic bones are very weak and prone to fracture. Exercise can combat effects of osteoporosis by stimulating osteoblast activity. Arthritis. Arthritis is inflammation of any joint. Causes include infectious agents, metabolic disorders, trauma, and immune disorders. Mild exercise can slow joint degeneration and enhance mobility. Typically, the bursa sacs of arthritic joints are inflamed, making movement extremely painful.